For those of you who are just entering the field, what are some of the things that you could perhaps look at to add to your practices that would give your patients an entirely well-rounded approach and to be able to provide many different services in your concierge or wellness practice? So coming on to gluten sensitivity, we all know there's been a significant rise in gluten intolerance awareness, which is fantastic in my opinion. The media is talking about it. Our patients are talking about it. Just before I went on stage, somebody who is here in the room came up to me and talked to me about it with their own child. It is something that we are seeing all around us. And we've all heard of the Hippocratic Oath. It has been said, all diseases begin in the gut. And I wasn't a believer of this as I was practicing traditional OBGYN. But now I feel that there is so much truth to that. We are what we eat. We've heard that before. But there are so many diseases that begin because we have a lot of inflammation in our GI tract. There are many studies that suggest that as many as 1 out of 3 people that we all know, so if you look around yourselves, if you have 3 people sitting together, 1 of you may have gluten intolerance. So what are we doing about that? How do we recognize that? How are we going to treat that? We'll go into all that. What is gluten? We've all heard of it. Gluten is a protein composite. It's a combination of prolamines and glutenins that are added to grains. That is what gluten is. And it's in many different things. It's in wheat, it's in barley, oats, and rye, for the most common things that we see in our American or Western diet. Gluten is an additive that is added to foods that otherwise lack nutrition. It has been recently introduced as something that actually helps with the texture of the food, elasticity of the food, and the binding and filling of food. So it's not a substance that we've had in our foods for centuries. We just haven't. It's a relatively new ingredient that's being added to a lot of different foods. So our bodies evolutionarily are not used to really processing this high quantity of gluten that we see in everything. Unless you're on a gluten or yeast-free diet, where all, a lot of us or a lot of our patients are eating breads and they're eating anything with grains and they're eating whole wheat this and whole wheat that and cereals, oatmeal, everything that we have for all this time considered it's so healthy. Oh yeah, well I eat whole wheat bread all the time, it's so healthy. Or I eat oats every day for breakfast. Or I eat bran cereals, they're so healthy. If you don't have gluten sensitivity, then perhaps. But if you do, it's actually going into your gut and creating a lot of inflammation. And then we as doctors are seeing what it does to our patients. Today, fortunately, testing is much more predominant to determine these sensitivities. People know what they might be looking for. Whereas in the past, perhaps about 5 or 10 years ago, people would complain of so many different symptoms that may be due to gluten sensitivity, and we as physicians, as healthcare providers, thought it would be totally something different. So people would come in, patients, how many of your patients come in on a daily basis with GI symptoms? They come in with things like abdominal cramping, bloating, gassiness, diarrhea. How many of your patients come in and they are on a multitude of medications for acid reflux, for heartburn? It's a huge multi-million-dollar pharmaceutical industry with your Previcids and Pepcids and things of that nature, when they may not need to be on those medications if only we can find out what is the true cause of those GI symptoms where they're not having regular BMs and not having all of these GI symptoms. So that's one of the things that I would definitely look at. If you have patients that are coming in with GI issues, and not everybody's going to come in and tell you, well, doc, I have bloating, gas, and constipation all the time. But you must ask these questions and then go deeper. The other thing, because we have an aesthetics side of our practice, but for those of you, even if you don't, skin issues such as eczema, psoriasis, rashes of unknown etiology, hives. When you see your patients have all these skin issues, one of the first things that you might want to think about is what's going on in their gut. What are they eating that may be leading to such inflammation and presenting it as skin conditions? We also see patients with respiratory issues all the time. How many patients, and I know in Texas it's a huge issue that we have, allergies. 90% of my patients will come in with some sort of allergy symptoms, whether it's coughing, recurrent bronchitis, asthma, postnasal drip, sneezing, runny nose. All of those things could be associated with gluten intolerance or other food sensitivities, things that we need to look at. There may be patients that come to you and say, well, I have all these issues with food. When I eat such and such, I might have diarrhea or vomiting or itching and burning and things of that nature. We need to look deeper to see what might be going on. It's important to realize, however, that gluten intolerance is not a disease, but it does create inflammation in our GI tracts or our entire bodies that then leads to disease. So it's important to make that differentiation, but realize that it is a serious issue.